Leanne Craze is an amazing woman who has been the centre of the circle of so much positive and amazing work that's been done in mental health and peer work in Australia. So Leanne's expertise lays in providing consulting services relating to social policy, program development and evaluation and legislation review. Leanne is the principal author of the National Framework of Recovery-Oriented Mental Health Services and has consulted on a number of other national mental health projects. Leanne has a PhD from the University of New South Wales and has held a number of academic positions. Since 1990, Leanne has operated her own consulting business, and she is incredibly important to us in mental health.
Thanks, Faye. I do hope that I can continue to live up to people's trust and faith, and to Faye's kind words as well. Thank you, Faye. So I'm just commencing to a project with the Commission that is looking to develop a guide to assist mental health services and non-government, but mental health services, whether they be public, non-government, peer-run, and also private, to develop the peer workforce and to develop and increase peer workers and also peer work-run programs and services. So today I'm giving a bit of an overview of how we have arrived at this incredibly important point in our history, and also exciting point, scary to many, but I think if we embrace it together in partnership, there will be great things that we will achieve. I'd like to commence with the story of the humble veggie burger. When I was conducting consultations around Australia for the National Mental Health Commission's Contributing Life Experience, an experienced health worker with qualifications in a health discipline came to meet with me, and she had a few points that she wanted to make. One was the importance of peer support from both her personal experience and also her professional experience. The next point was the need to develop the peer workforce, but also to develop it knowing the difficulties that current peer workers face that often can include discrimination, and also it's a discrimination and they are difficulties faced by mental health professionals who have made known their lived experience of mental health issues. But she told me this story, and it goes back about 25 years when she herself was going through a difficult period of some years with a psychotic illness, and she was receiving services in a rural mental health service that will go nameless. And she was telling me that she would not be the senior and experienced health worker that she is today without what her fellow patients and her peers provided for each other. And she told me the story of how it was in the days when inpatient wards had outpatient programs, and people who had been discharged could come back if they so wished and join in programs, rehabilitation programs that were being operated from the ward. And one of the programs that this particular acute service had was a vegetable garden. And an enterprising member of staff had said, well, hey, growing veggies is great fun, but let's do something with the veggies. And so there were gardeners' markets held not too far away. And so the inpatients and outpatients, they grew their veggies, and during the week they prepared all the ingredients and they made veggie patties. And they took them up to the growers' market every weekend and they ran a veggie burger stall. And they made lots of money. That became income for everyone who had contributed to the making of the veggie burgers, and also to those who were there at the stall. And she told me how that work that they did in growing the veggies, making the burgers, selling them, interacting with the public, supporting each other, week in, week out, making money, gave them a sense that they could recover, and they could see that they were recovering. And people who came into the inpatient ward, who joined the merry crew, gardening and making and selling veggie burgers, could also see, I can get better. My peers around me are recovering. And she said, many of us went on to go to university or to TAFE, and many of us who went through that program today are, if not experienced mental health professionals or health professionals, but are also otherwise employed. And she said, you know, as we've got older, we've gone into the peer workforce, because that's where our heart lies, because we understand the truth of the power of both intentional peer support and also the informal and mutual peer support. Australia, however, compared to other countries around the world, have been slow to embrace and build the evidence base for peer work. There are still, you still get, when I discuss the need to develop the peer workforce and what it can develop, I still get raised eyebrows and concerned, oh look, I don't know, just don't know about it, don't know. So we still have some work to do. I'd like to just take you through some key moments. The fourth National Mental Health Plan that's now expired, and to my knowledge, there's nothing yet on the horizon. But, 24 hours is a long time in politics and in government and in public administration. But that fourth mental health plan really did put the peer workforce, I believe, and on the map, and drew it to the attention of administrators right around Australia, because it made a commitment to developing the peer workforce. It also made a commitment to embedding recovery orientation in practice and in service delivery throughout Australia. And all of the Ministers for Health or Ministers for Mental Health at that point in time signed onto that agreement that this is what they would do. And yes, embedding a recovery orientation and a commitment to developing the peer workforce was part of what they were agreeing to do. Then we had the National Framework for Recovery-Oriented Mental Health Services, and people are probably aware of that and have seen it. It, in its own way, I believe, was important. And if people haven't already read and talked with colleagues about the capability for, which talks about acknowledging, valuing and learning from people's lived experience and from families, staff and communities. It's within the practice and service delivery domain of organisational commitment and workforce development. So it is actually seen as a capability within the recovery framework. And if you after this session, or you could Google now and have a look at it. I've no problems with anyone doing that right now and just getting it up on your phones or your iPads. You will see that it outlines some initial key principles, some values and attitudes by which we could say, yes, there is a commitment to learning from lived experience. There is a knowledge base present within our services in how we learn, how we utilise, how we unleash lived experience. And also the skills and behaviours that managers require, practitioners require, and services require. And then what will it take for our leaders in organisations to show a commitment to valuing lived experience? So I leave that with you and trust that you will read through that and talk with each other about, and even possibly use it to do an audit of what is currently being done within your services. Then we've seen the development of Certificate 4 in mental health peer work, and as I look around the room, I see people who have put many days, many weeks, probably a couple of years of their lives into bringing that into fruition, and we are currently seeing the rollout of that. A project that many may not have been aware of is Health Workforce Australia's Peer Workforce Project. I'll say a little bit more about that soon. And then we are currently seeing the National Mental Health Commission's Peer Workforce Initiatives. So the modules for the Cert 4 training, have people viewed those? Yeah, if you just go to the National Mental Health Commission's website, you'll be able to see the first set of training modules that have been released. Any response to them? I was very excited by them. Other responses around the room? People had a chance?
I thought they were fantastic.
Yeah.
I thought if I'd had these, I could have been so much better as an advocate. It was just fantastic.
Yeah. So look, they're there. Please do look at them, and I applaud the National Mental Health Commission for the work there, and also for making them publicly available. And so we're seeing the Cert 4 training being rolled out, the Champions of Mental Health Peer Work Initiative, and also mental health leaders. And also we have seen over the last, 5 years is it? The development of the New South Wales Consumer Worker Framework, which we hope will make its way out into implementation stage in the near future. So I'm going to skip through that. So where do I think the peer workforce can lead us? So can I just... Just looking for the... So I wanted to say that I think there is a growing conviction that it is time to grow the peer workforce. And Tim, I really didn't mean this to say that it's Tim. And I didn't mean to emphasise the importance of Tim, but it was my poor craftsmanship there. It really does mean to say that it is time. It's time to grow this workforce. So thanks, Tim, for just being so polite there and giving me the benefit of the doubt. So where can the peer workforce lead us? I think the peer workforce can help mental health services to put the people who are using their services or receiving care, support and treatment at the centre. And it can put their interests, their priorities first and centremost, and can redefine, redirect services to meet their priorities for a full life, the life they choose, with the people they love, doing the things they want to do and living the life they also dream of. So I think it can shift services to this and away from perhaps what is at times the interests of the services themselves and how they perceive they need to operate. So some of the practice shifts, I think there's also service delivery shifts, and some of these might be scary. For some services and practitioners, it might be like they're going out on the edge of a cliff. But in Australia, we always have a safety net. Well, we're hanging on to it, aren't we? But though for some it might be scary, we are not without considerable expertise in developing the peer workforce, and we are not without considerable guidance and resources available to us as well, which I will come to later. And just like people recovering from mental illness have told me, at times in those early days of leaving hospital, it's like I've got my P's, it's like I've got my L's. I think too, services and organisations, management, also need to go through a similar process of getting their P's, maybe getting their L's first, and then getting their P's in developing the peer workforce and increasing peer workers, and also designing peer-run services and supporting those services. And collectively then, the peer workforce combined with the existing workforce can see services shift to supporting people to do things they want to do, understanding that it's the normal everyday things of life, the pleasurable things, the fun things that have a lot to do with people recovering. So yeah, enjoyable things, people rowing their own boats. I think the peer workforce can help the existing mental health workforce to help people to live the lives they want and to row their own boats of recovery. So it will need collaboration, it will need some serious thinking about, at both the district level, the state level, and also individual service levels, about where are we at the moment. If we were to do an audit against the capability in the recovery framework of acknowledging, valuing and learning from people's lived experience, what would we discover? What would it tell us about how we are currently going? We then need to collaboratively work together to look at some of the difficulties and set strategies in place for overcoming those difficulties. And this is where I'd like to talk about, when these slides permit me to, about the Peer Workforce Project. There were 3 parts to it. There were case studies that were conducted with a sample of non-government, public, and I believe there was one private mental health service. And I can see Janet and Faye and Pam Rutledge. One of the case studies was with Richmond PRA. And then there were ones, a couple of others in New South Wales, and then in every state and territory. So that was looking at what's happening, what's working, what are the roles, how are they going, what are the work conditions, what are the problems, what needs to be improved, what's your advice for other services and for New South Wales and for other states and territories to develop the peer workforce. Then there was an online survey and also a literature review or a literature scan of the evidence. So there's 2 publications, they're both online. One was the report of the project, the other was the literature review. So please go online and find them. Any difficulties, just drop me a line. And over on this column, I have bits of information from the online survey of peer workers. 305 peer workers responded. which really, shows that they are probably amongst those peer workers who are not counted anywhere. You can see some of the stats there: 51% in NGOs, 17% in public hospitals, 53% were part-time, 18% casual, and a majority with qualifications. That so many were part-time and casual was very problematic, because the workers said to us, we are not able to work enough to be able to make a living. We're in a bit of a trap, and also our conditions vary from one service to the next. And peer workers also discussed the discrimination that they feel, and there were peer workers who did not feel that sense of discrimination, but some did, in that some had, for example, swipe cards, some didn't. Some were allowed in staff rooms, some weren't. Some were allowed to use cars by themselves, others weren't. And yeah, very mixed messages and also mixed conditions. The workforce, the HWA's peer workforce project recommendations, I think are very helpful in terms of where we find ourselves in New South Wales and also where we are wishing to be. So what's happening now? We have the rollout of the Cert 4. We have the National Mental Health Commission's initiative in supporting that rollout and in developing modules, so please go and look at them. We have the National Mental Health Commission leading a peer work initiative and also promoting the importance of mental health leaders with lived experience and also peer work leaders. So some of the key players are there that you can see, which brings us to the project that I am doing with the Commission, and am looking forward to speaking with you all over the next few weeks. So it is to develop a peer work guide that may include the importance of peer workers, key roles and functions, principles from employment and reasonable adjustment, training, support, supervision, coaching and mentoring, not just for the peer workers, but also for the professionals that they are working side by side with, preparation and planning for services and organisations, not just starting about it and then thinking, oh dear, we've started, but how are we going to do it? And workforce development, how to keep it going, and practical resources. There is also the question of whether we also, in the one project, include family and carer peer workers. So I'll be holding initial discussions with stakeholders about that. My apologies for cutting tweed heads off, and I think Ballin is cut off as well. No intention meant there. But the guide, once it is completed, and there will be opportunities for peer workers to help me write it, help me produce it, so there will be a series of discussions and drafts and where people can provide input as we go. So I'm very much wanting it to be a co-production process so that New South Wales can have some support. New South Wales mental health services and organisations can have some support and guidance in developing the peer workforce. So some practical steps: get talking, have a look at the recovery framework capability, compare that with what you're currently doing, have a think about what's needed, what else needs to be done, what should be done as a priority. So get reading, have a look at the HWA reports, have a look at the peer worker training modules, and also remember, it's not a scary world because we're not working in a void. There are an incredible wealth of resources out there, both people and also written electronic resources that we can use. And I think I would like to conclude with acknowledging and paying my respects to all of the peer workers here today, and also to the peer work leaders who are amongst us today, who are our most valuable resource in taking this forward. Thank you.